We are now live.
Thank you. This is the public hearing for the Committee on Public Health and Human Services. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Enquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come, and clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called.
Councilmember Heenan.
Present. Good afternoon, Chairwoman.
Good afternoon.
Councilmember O.
Yes, present.
Councilmember Gim.
Good afternoon, Madam Chair. Good afternoon, colleagues.
Good afternoon.
Councilmember Green.
Good afternoon, colleagues and everyone. Looking forward to an interesting hearing.
Councilmember Thomas.
Good afternoon, everybody. Good afternoon, Madam Chair. Happy to be here.
And Councilmember Brooks.
Good afternoon, everyone.
That is the end of the roll, Madam Chair.
Thank you. A quorum of the committee is present, and the hearing is now called to order. And again, this is the public hearing of the Committee on Public Health and Human Services regarding Bill number 200303. Clerk, will you please read the title of the bill?
Bill number 200303, entitled An Ordinance Amending Chapter 9-4100 of the Philadelphia Code, entitled Promoting Healthy Families and Workplaces, to establish leave time for public health emergencies, modify existing provisions concerning the paid sick leave, and make technical changes, all under certain terms and conditions.
Before we begin to hear the testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in this meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the question or comments that they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. And if we could have the clerk please call the first panel or witness to testify for this bill. And before they actually speak, we will then have comments from the bill sponsor, if she would like to make comments.
Yes, thank you so much, Madam Chair. I'm
sorry, we're just going to tee up the first panel, and then we'll have you speak afterwards, if that's okay with you.
Thank you.
Thank you.
Hi, the first panel includes Rich Laser and Dr. Thomas Farley, if present.
Okay, and while we're waiting for them, Councilwoman Brooks, if you'd like to proceed with your statement.
Yes, thank you. I want to start off by thanking my bill co-sponsors, Councilmember Gim and Councilmember Heenan, for their support of this bill, and to the countless workers, unions, small business owners, community organizations who contributed to this legislation. Having strong worker protections in place is the only way for Philadelphia to restart our economy and progress to the green phase without another spike in COVID-19 cases. We are living in unprecedented times during the worst public health crisis in a century. Current paid sick leave is simply insufficient to meet the needs of the thousands of workers continuing to report to work each week. These workers live in constant fear of contracting the virus and spreading it to their families, their co-workers, and to the public. And we cannot wait any longer for protection. The Family First Coronavirus Response Act and the CARES Act created some provisions for paid sick leave at a federal level. The problem is that this legislation leaves many workers out. In Pennsylvania alone, the law exemptions could leave out 3 million workers. Every worker needs paid sick leave during this pandemic, but it's even more pressing for low-wage workers, people of color, who make the majority of the essential workers in the city. The purpose of this bill is not to create unreasonable expectations for businesses that are already suffering. It is simply to provide reasonable protections for our workers, our businesses, and our communities so that we can avoid horrifying surge of COVID-19 cases that we are seeing in places like South Carolina and Florida. This bill is widely supported by local unions and worker-led organizations. My office held 11 major union and worker organizations to ensure that their needs were heard and responded to. They have been involved with the process in every step of the way. These organizations help ensure that our most vulnerable workers are covered and no one is left behind. We now have a total of 25 unions and worker organizations formally signed on to support this bill. The bill has also undergone a rigorous and thorough vetting process through the Law Department and the Department of Labor. The administration has been incredibly helpful and supportive throughout the past few months, and I'm confident that this bill not only protects Philly workers and to keep public healthier, but it can effectively be reasonably enforced. We engaged in extensive conversations with national experts to ensure that this legislation reflects lessons learned from other cities and states who have passed similar legislation and builds off that recent research. Places like Los Angeles, Seattle, Washington, D.C., and the state of Colorado are just a few examples of places that have passed legislation similar to the public health emergency leave bill we are discussing today. We did extensive outreach to businesses to walk them through this bill and receive feedback. Our office hosted a 2-hour roundtable discussion with a diverse group of employers to answer questions and address concerns. We held multiple follow-up calls with stakeholders following that roundtable to ensure that all issues that were raised were thoroughly addressed. Our office then made additional rounds of amendments to ensure that this legislation did not have any unintended consequences and would be easily interpreted and enforced. All amendments that were considered and included in the final bill were circulated to stakeholders the moment after we sent them to our fellow council members. I want to emphasize that my team has worked tirelessly to make this process as transparent, thoughtful, and inclusive as possible. Over the weekend, my office was in communications with concerned lobbyists and business owners and pursued additional changes to this bill to respond to their concerns. As a result, we went through 3 rounds of amendments that I believe adequately address these issues they raised. The Law Department has reviewed and approved these changes. The simple fact is that while some businesses may not prefer to pay for any paid leave for their employees because of the financial strain of COVID-19, our businesses and our constituents cannot afford for workers to come to work sick. Small businesses need relief, and I will continue to support calls for aid at the city and state level for these businesses. But if workers don't have paid sick leave, it will result in closures, lost business, and lost lives. We cannot continue to delay any further. Workers have desperately needed these protections since March, and it's time that we step up as a legislative body to protect these essential workers. I also want to acknowledge that while many businesses may be reluctant to provide paid sick leaves, many businesses are already doing so, and even going through and above and beyond to provide for their communities. The moment the pandemic hit, the owners of the South Philly Barbacoa immediately reached out to my office and asked what they can do to support workers and the community. I've been seeing amazing displays of community support across Philadelphia, coming from all corners of this city. This bill simply ensures that no worker is left behind. We need our economy to recover from these past few months, but we cannot choose profit over human lives. I want to thank the many people that have been involved in drafting and finalizing this bill. After 5 rounds of amendments and countless calls with stakeholders, I am confident that this legislation incorporates the feedback that we have received from stakeholders and balances the needs of workers with the needs of business community. I believe that this legislation will not only help workers, but will help the city to rebuild, recover, and reopen. Thank you so much, Madam Chair, and thank you so much to my colleagues.
Thank you very much for your comments. And we are going to go right into hearing from the first panel that's been called. I am going to ask that any comments or questions from the members of the committee that we hold these at this time, because we have quite a lengthy list of folks who would like to testify. And I think it's critically important that we hear from the people. So if we could proceed with the first panel, and if the clerk could recall their names again, just to make sure that they're in queue.
The first panel includes Rich Laser and Amanda Shimko.
Rich and Amanda, are you there?
Yep, we're here.
Okay, great. If you guys want to go ahead and get started,
Okay,
please state
great.
your name for the record and begin your testimony.
Good afternoon, Chair member, members of the committee. My name is Rich Laser. I'm Deputy Mayor for Labor. And I also have with me Amanda Shimko from the Director of Office of Benefits and Wage Compliance, who worked very closely on this bill from its inception. Bill number 200303 will add a new section of the Philadelphia Paid Sick Leave Ordinance to establish a new type of paid leave entitled Public Health Emergency Leave. If passed, this will create a pool of hours that hiring entities may make available to covered individuals in the event that a public health emergency is declared. I'd like to start by thanking Councilperson Brooks, the sponsor of this bill, and all of our co-sponsors for their leadership on this issue. The impact COVID-19 has had on the lives of all Philadelphians cannot be understated. Our city went from having a strong and growing economy to unprecedented unemployment and hardships in just a few months. While the big picture story is one of layoffs and a faltering economy, that glosses over the human trauma this epidemic has brought. In every neighborhood, we've seen layoffs, furloughs, and other events that have severely damaged our economic security. Across Philadelphia, people suddenly don't know how they will pay their rent. They're worried about utility bills, school expenses, and student loans. While it will not bring back lost jobs, the public health emergency leave is one way to limit the economic fallout on our families, friends, and neighbors. This bill will require that in the event of a public health emergency, hiring entities must provide up to 80 hours of emergency leave for their covered individuals. In many cases, these individuals would be traditional employees, but in other cases, these individuals would be workers who utilize the app ecosystem to earn a living. The administration thinks it's a critical section of the bill, since the hardworking people who rely on delivering our food, groceries, and transportation need in this time of crisis deserve to be covered. I also want to acknowledge all the work that has gone into getting this bill to the version we have today. There has been good conversation on all sides regarding drafts and redrafts, and I believe we have arrived at a place where most of the goals of the public health emergency leave are workable. One item I want to call out as a positive is that in most cases, this bill does not add any additional requirements to small businesses beyond what has already been put into law. Small businesses in our city have been hugely impacted by the COVID-19 shutdown and have specific regulations on them as a result of the Federal CARES Act. What we think bill number 200303 does well is it leaves those businesses alone while it captures other hiring entities to ensure that all covered individuals have access to emergency leave. However, there are a few points that I want to provide some caution on under the amount of leave section, which is Part 9-4116, Section 4, Part C of the subsection instructs the administration to establish a portable benefit system to be used for calculating public health emergency leave for covered individuals who have performed work for multiple hiring entities. While the administration does agree with this provision, we need to make clear that no such portable benefit system is currently in place here or in any other major U.S. city. Establishing one will take a significant amount of time. At a minimum, it will require Philadelphia's Office of Innovation and Technology to create a new technology platform from scratch, or likely issue a major technology RFP to select a platform that will fit our needs. it is likely that the process of developing this portable benefits program will take far longer than COVID-19 related emergency declarations. Another area of concern is in the bill is that it can include health employees paid through public funding such as Medicare or Medicaid. We believe it is unlikely that a local ordinance can add emergency leave requirements to people paid through federal dollars. With these caveats understood, I will say that the administration supports this bill, and I look forward to answering any questions that you may have at this time. Thank you.
Thank you. We're going to hold questions for a moment. And Amanda, if you want to state your name for the record and begin your testimony, and we'll take questions after that. Rich, I did not ask you, but I am going to be asking everyone going forward. So please limit your testimony to 2 minutes. That's okay. You were at 3 minutes and 30 seconds, so you were just slightly over.
Yeah, just and real quick, Amanda from my staff, she doesn't have any prepared testimony. We're just here for questions.
Oh, okay, fantastic. So that covers the both of you then.
Yes.
Okay, any questions from members of council? Okay, seeing none, thank you very much for your testimony.
Thank you.
And if the clerk could call the next panel.
Jared Make. Hold on. Sorry.
Madam Chair, I do have a question.
Okay, Councilman Green, Chair
Yeah, I put it in the
recognizes
text.
Councilman Green.
Yes, I want to, Mr. Lakers, thank you for your testimony. I want to follow up on your points in reference to those last points you made regarding Medicaid or Medicare funded individuals, and you raised some concerns. So I didn't get a full context. Are you saying these should be amendments to the bill or not, or have they been amended in the bill with the recent proposal of amendments we just received?
I don't know if they're in the recent. Amanda, if you want to jump in, I know you work closely with the office of Councilmember Brooks, but I don't think they were changed at this point. I think we were just concerned that we don't believe we can add additional requirements on federally funded positions that get federal funding. But
from the perspective of administration, you don't believe you can add additional requirements that supersede federal law. So is that a request? Has that information been provided to the sponsors of the bill for that amendment?
I'll jump in and explain something technical about it.
For the record, could you state your name for the record so the stenographer can have that information?
Sure. Thank you. Sorry about that. My name is Amanda Shimko. I'm with the Mayor's Office of Labor. To address your sort of two-part question, the health care workers who are paid by public funds, we can likely address that via regulation, just making it clear that we are not talking about people paid by public funds. So we don't need any amendment to the bill, in our opinion. And the other question was about the portable benefits system. And it says the administration shall create it. And we will be working on a portable benefit system. We were just making it clear that it likely won't be available in the time frame that is set out, but we don't think it needs to be officially amended. We don't think there's any violation of law. We just wanted to make it clear that it likely won't work in time for this particular public health emergency.
Right, in reference to, because my understanding, the most recent amendment to this bill would have the legislation expire at the Cochumer's time, along with the Federal CARES Act, which is December 31st of 2020. So you're just putting on the record that although the legislation says it shall be created, you don't think the ability for the administration to create it by the end of December 31st, 2020 is feasible.
Correct.
Okay. And then going back to the first point, you said that it'll be just through regulations. Okay, I have an additional question for Mr. Laser. Oh, I'm sorry, miss your name again, I'm sorry.
Amanda Shimko.
Amanda, okay, so you said that's your opinion. Is that your opinion from the mayor's office? Was that opinion from the law department as well in reference to doing this cleanup work in the regulations as opposed to an amendment?
Yes. Yep. We had gone over this with the law department.
Okay. All right. And then, Mr. Lays, I wanted to follow up to your earlier questions about you made reference to balancing between the economy and the legislation. Has there been any input from the Commerce Department or other entities within the administration regarding what impact this legislation would have, I guess, with the amendments and how it will or will not impact small businesses?
Yeah, I mean, we've had an internal group through my office, the Office of Finance, and the Office of the Commerce Department, and we feel comfortable with the amendments that I've proposed.
And so based on various emails and calls that multiple have received, how does the amendments not impact small businesses from your perspective?
I think with the carve out piece that I talked about, that those anybody under 500 employees are already covered by the Federal CARES Act. So we feel that does help address that issue.
And I'm sorry, you're referring to what section of the amendments?
I don't have the amendments in front of me. Amanda, do you have the amendments in front of you?
Yeah, it's number 2.
Mm-hmm.
It's covered by the Federal CARES Act. You are not covered by the public health emergency. It makes small businesses, 500 or less, are already covered by the Federal CARES Act, and the public health emergency leave doesn't apply to them.
Okay, so under the CARES Act, businesses under 500 employees are covered by the federal government, and this legislation does not apply to them.
Correct.
Okay. Thank you, Madam Chair.
Okay, thank you. If we could have the clerk call the next panel. Or unless there are any other questions, I'm sorry, let me just double check. Oh, I'm sorry, Councilman Heenan has a question. And then after that, Councilwoman Brooks has a question.
Thank you, Madam Chair. I believe a few of my questions have been answered. And, I really just wanted to,
have it be noted that, this bill does not pertain to, businesses that are covered under the Federal CARES Act. All right, so that was one. And again, could the administration explain that, what it's doing is adding employees that aren't covered at all, like gig workers and such. So it's expanding to those businesses that have been obliterated, under this pandemic, which sunsets, with the tax credits that the federal government will eventually be rolling out. So one, who does it cover that's not covered by the Federal CARES Act? And two, just I wanted to, restate that, that this bill does not cover people who are already covered by the Federal CARES Act and family. So they're my two questions. If somebody can answer that.
Yes. So it expands. This is Rich Laser. It expands for workers that do not get it now. So healthcare workers that are exempted from the CARES Act, gig workers that are exempted from the CARES Act, and also businesses that have employees that are over 500 employees in a business. So it extends it to those folks. Now, Amanda, if there's anything I missed, I wanted to mention, but I think that's the folks that get covered under this.
No, that's exactly right.
Okay, and the businesses that are over 500, they would be national companies, is my understanding, that are local chains. Maybe is that one of the reasons why, or that would be helpful, all right, for those types of workers as you described.
Yeah, I think they could be both national. I think it's also just to close that safety net gap that was created by the Federal CARES Act, because they exempted out folks, businesses of over 500. I think it captures those folks, and the other two folks that I mentioned captures them as well to make sure that
Okay, I don't have any further questions at this time.
Okay, thank you. Thank you, Councilman. Councilwoman Brooks?
Yes, real quick. I have a question for Mr. Laser. You mentioned the portable benefits section in that. Has there been a way for labor to implement this law for those workers who are gig workers or work for multiple employees without this portable benefit system in place?
You're saying, can we enforce it without the portable benefit system?
Yes.
Yeah, I believe we can. Yes.
Okay. And my next question is for Amanda. Has this committee passed a bill out of committee recently that would have had the same concerns about Medicare and Medicaid that you mentioned?
Yes.
Thank you.
All right, thank you. And if we can have the clerk call the next panel.
The
Madam
next panel.
Chair,
Oh,
Yes,
Madam-
Councilman Green? Councilman Green?
Madam Chair.
Yes, Councilman Green, I see you
Okay,
have
sorry.
another quick question.
Yeah, one quick question. One, Mr. Laser, you said something about healthcare workers and gig workers were not covered under the CARES Act, as well as anyone that is over 500 employees are covered by the CARES Act, correct?
Correct.
All right, so for healthcare and gig workers, regardless of the size, I'm gonna make sure I understand that, because it would seem like a distinction between healthcare and gig workers, regardless of the size, are now included in this legislation, and then any employer over 500 employees are covered.
Correct.
So if you're a healthcare worker that works for a small business or a gig worker that works for a small business under 500 employees, you are also covered.
Correct.
Yeah, I just want to make sure I understand it. And then one other quick thing, from your perspective as head of labor for the city, I know when we had conversations regarding paid sick leave, there was an ongoing discussion, debate regarding the impact of collective bargaining agreements. How the CBAs are affected, how are they affected by it or impacted by this legislation?
So there's exemptions in this, but I'll let Amanda break it down because it's a little more complex than the original paid sick leave exemption back when that happened.
Amanda Shimko. This bill allows for collective bargaining agreement, so both parties in a collective bargaining agreement to sit down and explicitly bargain their own protections should they want to bargain something different than this bill provides. It does require that those parties agree to something similar as that this law provides. So they can't simply bargain it totally away. It does require that both parties stay in some way of, giving an emergency sick leave, but they can explicitly sit down and bargain their own agreement.
So it allows them to bargain their own agreement at the same level as this legislation, but it won't take out an existing collective bargaining agreement that may have more benefits than what's being proposed here.
Correct. If you are a business or a CBA that has more protections, you should keep those. This bill doesn't touch that.
Right, so this will not impact an existing CBA that has a higher standard of protections than what's being proposed, but allows the option to do negotiation between both parties at the same level of this legislation.
That's right, yes.
And that's also not considered any type of reopener of the CBA at all?
They would, but it's not. There's nothing illegal or it's an acceptable practice to have a law passed that says both parties can sit down and reconsider something based on a new law that was written.
Okay, thank you. Thank you, Madam Chair.
Thank you. Good questions. Thank you. Okay, and if we can have the clerk call the next panel.
the next panel includes Jared Meek, Tahira Sanders, Ben Miller, Meg Carroll, and Chris White.
Okay. And if those folks are online, if someone would state their name for the record to begin their testimony from that panel.
Sure. Good afternoon. My name is Jared Make, and I'm testifying in strong support of Bill number 200303. I'm Vice President of Labor Balance, a national legal nonprofit with 4 regional offices, and we provide legal and policy support to advocates and officials in all of the states and cities, including Philadelphia, that have passed paid leave laws.
Mr. Mink, you're muted. You're muted. Can't hear you. Can't hear you. Mute.
Hello?
Okay. There we go. There we go.
Great. Sorry about that.
That's okay. And also, I'm going to start from here, but we are asking you to limit your testimony to 2 minutes because we have such a lengthy list of folks who would like to testify. So, okay?
Great. Good afternoon. My name is Jared Make, and I'm testifying in strong support of Bill number 200303. I'm Vice President of A Better Balance, a national legal nonprofit with 4 regional offices. And we've provided legal and policy support to advocates and officials in all of the states and cities, including Philadelphia, that have passed paid leave laws. Although the federal government passed temporary emergency paid sick leave legislation in response to COVID-19, as you've heard, approximately half of Pennsylvania's workers are excluded from it. The federal law exempts individuals who work for an employer with 500 or more employees, allowing major corporations to bypass the law. And the federal law also leaves behind many of the essential frontline workers who are taking care of us, keeping our food stocked, and delivering essential services during the pandemic, all while risking their own health. And it's important to note that, as you heard, this proposed bill simply fills these gaps by covering workers who aren't entitled to leave under the federal law. Many other states and cities around the country are filling these federal gaps by extending public health emergency leave to workers who are left out. And the rationale is clear. No worker should feel like they have to go to work when they or family members are ill, including with COVID-19, but too many low-wage workers have insufficient paid leave and are forced to make impossible choices to make ends meet. And when workers go to work sick, they threaten their own health, their colleagues' health, and the health of the community. And studies have also shown that workers on average don't use all of the sick days available to them, and many don't use any at all. The workers save their paid sick days for use when truly necessary, an important fact to remember when considering this bill. So as the fight against COVID-19 continues, workers have a clear need for a safety net of public health emergency leave that they can use if necessary, and the research is equally clear that this proposed ordinance will benefit workers, businesses, and the city as a whole. So based on that need and evidence, my colleagues and I hope that the City Council passes this measure into law without delay. Thank you.
Thank you. You were right at 2 minutes. Wow, that was amazing. And great testimony. Thank you so much. If we could have the next person, we're going to hold questions for the panel until the end of all the folks who are on this panel have testified. So, Mr. Mink, if you could just hang around for a second in case anyone has questions. The next person to testify from that list, if you are ready and teed up, please state your name for the record and begin.
My name is Benjamin Miller. Thanks. And my wife, Christina Martinez, is a chef and owner of South Philly Barbacoa. It's Casa Mexico and El Compadre on 9th Street in South Philadelphia. We've been serving our food in Philadelphia, and on a busy day before the pandemic, sometimes the South Philly Barbacoa would serve over 2,000 people in a day. Many of our customers drive from out of town just to eat at the restaurant. Since the COVID crisis, we pivoted our business to doing takeout, and we've also began cooking over 1,000 free meals to the community every week. And I'm here in support of Bill number 200303. From the pandemic, we felt a strong sense of support from our community of customers who helped us stay afloat and let us know how important we are to their sense of normalcy and enjoyment. Food is central to the culture that we gather around in this city, and the food service workers who are often unseen and unthanked are the ones who keep the restaurants open as hubs of social gathering and culture. I've worked in the restaurant industry for 15 years in various establishments before opening our own business. From my experience, I've seen workers contract an illness and continue to come to work. Within a week, everyone in the kitchen, as well as the front of the house staff, gets sick. I don't fault the worker for coming into work sick. Often there's no backup or substitute worker to fill in, or they're fearful of losing their job if they don't show up. This is especially relevant in light of the proliferation of undocumented workers in the restaurant industry, many who do not have a strong grasp of English or the labor laws here. People work from paycheck to paycheck and cannot afford to take sick time. Often people feel pressured to work sick from their boss. You'll hear testimony late today from other restaurateurs and that have been organized with the Pennsylvania Restaurant and Lodging Association. And I just want to say that the PRLA does not speak for all restaurants. And we've been on the other side of the battle with them before against raising minimum wage and eliminating the sub-minimum tip wage. I want to say that the restaurant can be a dangerous place for a contagion to spread, and many people using the same tables all day. Although we're keeping our effort, we're making the best efforts to keep everything sanitized. The reality is that a pathogen could spread quickly. In light of the COVID epidemic, we see how crucial it is for sick people to stay home. The legislation proposed by Councilmember Brooks would help level the playing field for businesses who do the right thing to protect their staff and communities. and customers from sick employees by giving paid sick leave, making a requirement rather than a benevolent act. We can't trust all business owners to do the right thing. We need to mandate that they do the right thing in the interest of public health. And this often becomes an issue when exploitative measures and cutting corners to increase the bottom line is competing with family small businesses which do the right thing. We look to City Council for this type of support, allowing small businesses to thrive and our communities to stay safe. As we reopen, it's imperative that all businesses allow their workers to stay home and take care of themselves when they get sick without having to give up their wages. And I want to thank Councilmember Brooks and her office for including me when she first started working on the bill and including my thoughts and recommendations throughout the process. I ask the members of this committee to vote yes on public health emergency leave today. Thank you.
Thank you. Thank you for your testimony. We're going to hold questions. And if we could have the next person who was scheduled to testify in this panel come forward and state your name for the record and begin your testimony.
Yes, hello. This is Chris White.
Hi, Chris.
How are you?
I'm very well. Please state your name for the record and begin.
Yeah, it's Chris. Our proper name is Christopher White. And my phone is about to die, so I'll be brief. So please forgive me. And this is I'm an essential transportation worker in Philadelphia, a member of the Philly Drivers Union, and a father and a son. I'm testifying today in support of Bill 200303, Public Health Emergency Leave. So I'm told I'm a gig worker, which trivializes how much the family depends on my income from Instacart, Uber, and Lyft, and Uber Eats. We did not suddenly become essential during the pandemic. This has just become more obvious that we are risking our lives in a way that has grabbed the nation's attention, and not all everyday ways our lives in danger driving around Philly. As an app-based transportation worker, I'm left out of basic guarantees if I should become sick. I'm not even protected if I refuse to allow passage in my car without a mask. Drivers are routinely deactivated. App speak for flyer are eventually physically attacked or assaulted for safety rules. During the non-pandemic times, ask long-time drivers and other Philly community drivers that stories of accusing passengers with no seat for their children to try to squeeze in extra people. And when we are assaulted, neither Uber, Lyft, or the Philadelphia Police Department does anything to protect us. Sorry if I'm stuttering, if I'm talking fast. I don't want to die in between my sentences. I'm afraid to die, so please forgive me.
Okay.
The reality is that more transportation workers will get sick as the economy reopens. Vehicles are one of the highest risk environments to pay our own bills on regular work. With app companies cutting our rates constantly, this means an increased number of passenger interactions. Like, for example, I've had people where we're only supposed to allow 3 people to sit in the back, but they'll try to squeeze 4 or 5 people. Then if you tell them, well, you can't do that, they'll get upset and they'll threaten to either give you a low rating or threaten to report you. I've had my window jammed. That had to come out of my money. I've had to have oil changes, tire changes, and I have to have like minor body work done to my vehicle, which of course comes out of my pocket, and Uber doesn't help with that. So I just needed to add that also. All right. If we're not able to drive, or if we have a problem with our vehicles, our expenses don't disappear. We still have a car note. We still have to pay our insurance, and we still have to pay other bills. If my vehicle, for example, was to go in a shop, or I'm not able to drive it for 2 or 3 weeks, I lose my source of income, and that affects me to be able to pay my bills. App-based transportation workers, or so-called gig workers, are essential in the city of Philadelphia. Guaranteed protection today, tomorrow, and always, not just during a health crisis. Sick pay saves lives. Gig work is real. Thank you, council members, for voting yes on the Essential Workers Bill and rights. And thank you to council members Brooks and Jim for your tireless work to ensure our rights are recognized even after this crisis ends. Thank you.
Thank you, Mr. White. And if we could have the next person scheduled to testify, please state your name for the record and begin. If we can have the clerk recall that panel, just so that we can make sure everybody who was on heard their name.
Tahira Sanders and Meg Carroll.
Hello.
Hello.
My name is Tahira Sanders, and I'm a home care worker.
Tahira, Miss Sanders, can you speak up slightly? I'm
Yes.
having a hard time hearing you. Thank you.
Yes.
We're going to ask you to state your name for the record, begin your testimony, and we're going to ask you to limit to 2 minutes.
Awesome. Good afternoon. My name is Tahira Sanders, and I'm speaking in support of Bill number 200303. I'm a home health care worker. And
I can barely hear you, Miss Sanders.
Okay, can you hear me a little better now?
It's much better.
Okay. Good afternoon. My name is Tahira Sanders, and I'm speaking in support of Bill number 2003. I'm a home health care worker, and I have been doing this work for about a year. My union is SEIU, United Home Care Workers of Pennsylvania. I've taken care of my mother, who has a cousin who was relieved of my grandmother, and now I my grandmother. As a home care worker, I'm an essential worker. Without people would have to go into nursing homes, and COVID shows us all how dangerous nursing homes are right now. But because we work in people's homes instead of healthcare facilities, we're getting to keep our finances safe. Families First Act didn't cover us. We need pay just as much as any other essential worker. Why was I not on the front line of COVID? And we need to be able to take care of ourselves. If we get sick, we work with people who are to go work sick. But what choice do we have? I got a baby and a son at home. I can't afford to lose income if I get sick. And I need to keep them healthy too. Please pass Councilmember Brooks.
The record and begin your testimony. We're asking you to limit to 2 minutes if possible.
Yes, my name is Meg Carroll. I'm the HR manager at Mariposa Food Co-op. Mariposa Food Co-op is a community-owned grocery store in the Cedar Park neighborhood of Philadelphia. I am testifying in support of the Public Health Emergency Leave Bill. At Mariposa, we offer all employees generally accrued because we know health is critical to keeping our community healthy. We operate our business with the use of end statements. This means that if we do and accomplish everything we set out to do, these statements will be true. A welcoming, accessible, and affordable alternative, Mariposa is a community in which systems of oppression have been dismantled. Mariposa has policies and practices that support environmentally and economically sustainable food systems. Mariposa is a model for good jobs and workplace democracy, and Mariposa's community members care for one another. We are all connected. Providing employees with adequate paid time off helps us work towards each one of those statements. Before this pandemic, we would welcome anywhere from 800 to 1,200 shoppers a day in our 2,500 square foot store. Right away, we recognize that our staff are at a greater risk for contracting COVID-19, especially considering the close quarters we work in. We knew we had to change our practices immediately. We started limiting the number of people in the store, increased our sanitizing, and installed plexiglass barriers around our cash registers. But even with all these extra precautions, staff may still get sick despite having a fairly generous paid time off policy. The average worker at Mariposa only has 46.10 hours of available PTO, which is not enough if a worker is suddenly forced to care for a sick family member or forced to quarantine for 2 weeks. It is for this reason that we also amended our PTO policy to allow all employees to go into the negative with their PTO up to negative 80 hours. But this should not be the norm. Workers should not have to take what is essentially a loan from their employer that they will have to work their way out of in order to keep their families and communities safe.
Ms. Carroll, you're at 2 minutes.
I will skip to the end though, then.
If you could just summarize and wrap up, that's fine.
Yeah, at Mariposa, we work hard to implement policies that keep our workers safe because maintaining a healthy work space is necessary to operate a functional business. I'm proud to testify in support of public health emergency leave bill today because I believe that when we protect our workers, we protect everyone.
Thank you very much. Thank you very much for your testimony. And do we have any questions from the members of council? Any questions or statements? Councilman Brooks?
Yes, I have a question for Jared. Can you tell me how this bill would impact a healthcare employer that has 500 employees or less?
Sure. So, a very problematic aspect of the federal law, its emergency leave provisions, does allow healthcare providers to exclude their employees from the law. They do get through tax credits if they cover their employees, wage replacement that covers that. But what's of particularly concern to better balance from a public health perspective and a workers' rights perspective is that the Department of Labor, the Federal Department of Labor, very broadly defined healthcare provider, so that essentially, even if, say, you work in maintenance at a healthcare facility or even a laboratory that does some sort of medical testing in another division, you could be excluded from the federal law. So it's particularly a concern, one that many cities and states are filling that gap. And then in particular, from a public health perspective, could be a real concern if there's somebody who's working at a job that, whether it comes into contact with folks with compromised immune systems or could spread illness through a facility. So really something that it's important to try to address as well, along with some of the other gaps in the federal law.
One other question. You said those providers would be able to access the tax credit under the federal law. Am I correct?
That's right. Yeah, you're able to get reimbursed through advanced tax credits under the federal law.
Yeah, that was my name. How does that exemption work? Yeah, thank you.
Sure.
Okay. Thank you, Councilwoman. Okay, and if we could have the clerk call the next panel to testify.
The next panel includes Terry Fromson, Ashley Jimenez, Hemi Park, Kevin Fuller, and Calvin Wongus.
Okay, very good. And if we could have any of those folks, if you want to state your name for the record and begin your testimony. Again, we're asking for your testimony to be 2 minutes. And whoever's ready can go first.
Yes, good afternoon.
Okay.
This is Terry Fromson.
Okay, Ms. Fromson, if you want to state your name for the record and begin your testimony.
Yes, thank you. Good afternoon. I'm Terry Fromson, and I'm testifying in support of Bill number 200303 on behalf of both the Women's Law Project, where I am managing attorney, as well as Community Legal Services. We have been working closely with the Coalition to Respect Every Worker to pursue policy solutions to meet the needs of workers impacted by the pandemic. The bill before you today is such a policy solution. It will provide urgently needed relief to workers harmed by the pandemic and reduce risk to the public health. This pandemic has exposed and exacerbated long-standing disparities in economic security that harm low-income workers, particularly women and people of color. It has also exposed gaps in our existing laws at all levels of government, including the lack of comprehensive paid sick days and paid family leave policies. Thanks to this body, Philadelphia has a paid sick days law, but the law doesn't come close to addressing the impact of the pandemic. Unpaid sick days, which this city's law currently allows for employers with under 10 employees, is simply useless for people living paycheck to paycheck. The 40 paid hours that those working for employers with 10 or more employees is insufficient in this moment. The law's 90-day waiting period and accrual requirement reduces access to the leave it provides. As discussed earlier, the federal COVID paid leave provisions have left millions of workers without paid leave. These workers include women and people of color without paid leave who are on the job on the front lines and are dying at higher rates from COVID-19 related complications because of systemic racism that has resulted in a higher incidence of underlying health conditions, exposure to the virus, food insecurity, and lack of access to health care, among other barriers. Without paid leave, workers cannot afford to not work when they are ill. They take the virus back to work and they infect others. Increased health risks loom as workers return to workplaces that lack paid emergency leave and lack safe working conditions, imperiling the public. It is important that this bill provides paid leave to the variety of workers that have been previously discussed. They are typically left out of existing work protections. We believe they are employees under the relevant legal tests, but this bill ensures that they are covered by specifically describing them.
Ms. Robson?
Yes.
We're over 2 minutes.
May I just add one more point?
If you could summarize, sure. If
Yes,
you can summarize and wrap up, that'd be great.
Thank you. I'm sorry. As originally drafted, this bill made public health emergency leave a permanent part of Philadelphia's paid sick days ordinance. It has now been amended to lapse. We believe it should be made permanent and ask you to return this subject in the fall to enact a permanent solution. Other jurisdictions foresaw pandemics and incorporated public health leave in their laws. We were caught off guard, and 3 months after the emergency was called, people are still impacted. We urge you to vote for this bill out of committee and take steps to make sure it can be approved before the end of this session so it can provide the assistance so many workers need. Thank you.
Thank you. And if we could now have the next person in that panel state your name for the record and begin your testimony.
Yes, good afternoon. My name is Ashley Jimenez. I am the Director of Case Management and Social Services at Center for Hope, which is an emergency shelter in the city of Philadelphia. I'm also a mother of 3 school-aged and 1 pre-K son, and I am here today to present testimony in support of the proposed bill 200303. During the pandemic, employers became more and more aware that they had an obligation to the safety of their essential employees during a public health emergency. Organizations such as Center for Hope, which is also a program partner of the Urban Affairs Coalition, and whose current sick leave policy is consistent with the proposed bill, we recognize that the current required 5-day sick leave policy for public health emergencies, it wasn't enough to adequately address the need of our employees. So on May 1st, we updated our sick leave policy to include a 14-day sick leave benefit for all employees affected by coronavirus. And we are of the utmost belief that this benefit should be provided to all essential employees during a public health emergency. I myself was very affected by the coronavirus when it hit, and I immediately felt a sense of anxiety around what I would do with my children, knowing that I still had to go to work. Once our agency updated this policy, I saw a lot of that anxiety that I was feeling, and that was clearly others were feeling as well. That anxiety dissipated greatly. That time gave essential workers the time to address medical concerns that were popping up, particularly medical concerns that were popping up in the workplace. So as we provide emergency housing to the most vulnerable people, we were coming in direct contact with individuals who were contracting this virus. And our employees were still showing up.
Ms. Jimenez?
Yes.
You're over 2 minutes, so if you could summarize for us, that would be great.
Absolutely. So we have seen the benefit of the increased paid sick leave during a public health emergency, and it is without a doubt needed for individuals.
Hello? Ms. Jimenez?
Yes, thank you.
Okay, I'm sorry. I didn't hear your end, but thank you for your testimony. Thank you so much for being here today. If we could have the next person on the panel state your name for the record and begin your testimony.
Hello, this is Calvin Wong.
I think if it's gonna be hot like this, then yeah, let's fucking.
Calvin?
Be a little bit better.
Yeah.
Hi, is this Calvin Wongus?
Probably because of company policy. You know?
So much stuff.
You know what I mean?
If you could state your name, Calvin, if you could state your name for the record and begin your testimony.
Yes, this is Calvin Wongus, and I am a member of Pennsylvania.
Calvin, we're having some difficulty hearing you. If you could speak up and...
I'm sorry, can you hear me now?
That's much better. Thank you.
Awesome. My name is Calvin Wongus, and I'm a member of One Pennsylvania. In March, in the midst of the pandemic, I started working in a warehouse at a local clothing chain. Many workers worked together in close proximity. I noticed that there was no social distancing. We did have masks, but gloves were optional. We had to line up for our PPE, very similar to animals or dogs, basically just waiting for their equipment and it being handed out one by one very slowly and us being around each other without equipment. Also, we were in fear of also making our family sick just because of the fact that, things like gloves were optional. And we were also touching material like plastic. But we also all needed money. And that was something we discussed also as workers. And HR also made it clear that we were also expendable when we complained about, one mask a day, and having shifts as long as 16 hours. They told me I could just stop coming in at sometimes, and that I didn't have to work some days if I didn't want to. Throughout this pandemic, I feel as though people of color and low-income people are the ones that are working, and we're also being taken advantage of. We had our temperatures taken when we came in, so glad, anybody that was sick wasn't allowed in the building. But those who got sick were actually told to stay home with no pay. And these are, a lot of individuals who worked in the warehouse. If you even missed a couple of days, it's kind of like skipping meals the next week. And I would not be able to cover for transportation, and it would make a bad situation even worse during this pandemic. We work also to risk our lives every day and to keep Philadelphia running. If we're essential workers, I think we deserve basic dignity and benefits. The paid sick leave expansion would protect workers like me and allow me to stay home when we're sick without worry. Please vote this bill out of committee today. Our lives really depend on it.
Thank you, Mr. Wongus. Thank you. Okay. Thank you, Mr. Wongus, for your testimony. If we could have the next person on the panel state your name for the record and begin your testimony.
Hi, my name is Hemi Park. I'm a restaurant industry worker. And
I'm sorry. Speak up a little bit more. Hi.
Hi. My name is Hemi Park. I'm a restaurant industry worker and a graduate student in public health, specifically in epidemiology. I support the bill number 200303. As restaurants are reopening and my unemployment benefits are coming to an end, all during a global pandemic, I feel extremely uncertain about my near future. Last week, when the outdoor dining services reopened, I was asked to return to work for one shift a week. And if I do not go back to work, I will lose my unemployment. I have no choice in the matter, even if I feel unsafe. For me, the financial implications of getting sick far outweigh my concerns about my own health. Not only can I afford to miss work if I become ill, but I also don't have health insurance because the restaurant I work at, as is the case for every single restaurant I've ever worked at in Philadelphia, does not offer affordable health insurance. In the case that I contract the virus and become sick, I would be out of work for an unknown amount of time, not making any money, spending money I don't have on treatment, and risking the physical health of people around me. This bill would ensure that I return to work with dignity, and upholding and practicing this law would be the least my employer can do to demonstrate that I'm not just a disposable moneymaker. I've worked in this industry for almost 10 years. If you've ever done this kind of work, you know that it's an industry norm to be working when you're sick and to risk getting fired when you call out sick without finding coverage. Taking a sick day is often viewed as a lack of loyalty, self-discipline, and work ethic. And if you've ever worked in restaurants, you also know that it's nearly impossible to social distance in the cramped spaces of dish pits, kitchens, and back of house areas. Food industry workers navigate tight spaces, adding on the reality that we are constantly handling the plates, beverages, and food items for diners. This makes for easy transmission of the virus. My colleagues and I have been closely watching what has happened in states like Florida, where they quickly progressed the reopening and now are seeing a horrifying surge of COVID-19 cases, and worrying that we will be subjected to the same reality as PA progresses to this green phase.
Ms. Park, you're at 2 minutes.
Okay, I'll just summarize.
Thank you.
So this bill would make sure that I'm properly taking care of myself and my family members and taking long enough sick time to allow 100% recovery without jeopardizing financial situation. One more point, sorry. As the daughter of working class immigrants, I feel strongly that protecting workers is a racial justice issue. The labor of low-income people of color, especially those who are Black or brown, including undocumented workers, is the backbone of the Philadelphia restaurant industry. So many of these workers are uninsured and simply cannot afford to stay home when they're sick, let alone seek medical attention. It is hard for me to see my friends in the service industry be forced back to unsafe working conditions without a choice. These race gaps and vulnerability to COVID-19 are affecting and killing our community members of color daily. It is absolutely necessary to address these intersecting inequities and provide workers with common sense protections so people of color don't have to work harder and work more hours to live sicker and die quicker. I'm here today asking you to support the bill number 200303. Thank you so much for letting me speak.
Thank you for your testimony. We're going to hold questions to the end. If the clerk could call if there is anyone else left on the panel to call them forward.
Yes, last is Kevin Fuller.
Hi, my name is Kevin Fuller. I'm with SEIU 32BJ as a political organizer. The person who was scheduled to speak today originally was Tammy Richburg, but unfortunately she had to go to the hospital early this morning, but she asked that I read her testimony for her. I am Tammy Richburg, a security officer in Philadelphia and a union member with SEIU 32BJ. I know all too well what it's like to not have paid sick days. I have pre-existing health conditions, so I had to come out of work. I had to take a leave of absence because I do not have security on an ICU floor, or because I do security on an ICU floor. My son successfully battled COVID-19, and I've buried 9 loved ones who died from the virus. We know the disease disproportionately impacts people of color and how essential workers are mainly people of color. It's like double jeopardy. We can't win. Workers need to be able to stay home and take care of themselves when they are sick. I am an essential worker. My union sisters and brothers are on the front lines facing the reality that they can get this virus. In this time of uncertainty, workers shouldn't have to worry about getting sick and having the time to take off to fully recover. None of us know how long COVID-19 will last or when there will be a vaccine. We want to know we'll be able to take care for ourselves and our loved ones. Having a public health emergency leave will help alleviate the stress of the current situation on all workers. Thank you.
Thank you for your testimony. And is that the end of the panel, Madam Clerk?
Yes.
Okay. Are there any questions from members of council for this panel?
Madam Chair, I have a comment really quick.
Yes, ma'am.
Yes, I just want to send my well wishes to Tammy Richburg, which was supposed to be speaking from 32 BJ, who was unable to attend today. I hope she's feeling well, and make sure you send her my well wishes, Kevin.
She is feeling well. She's feeling better.
Absolutely. Please send from all of council. Thank you.
Will do.
Yes. Any other comments, questions? And if not, we could have the clerk call the next panel.
The next panel includes Mark Tyler, Norman Henderson, Mitch Brewster, Elise Ford, William Carter, and Samuel Jones.
Very good. And if we could have that panel, please come forward, get in queue, state your name for the record. If Mark Tyler is available, if you would state your name for the record and begin your testimony.
Yes, Madam Chair, and I stated with an objection, Mark Tyler, Pastor Mother Bethel AME, and you're giving a preacher 2 minutes. That's unfair. So,
I know you can do it. I know you can do it.
Well, you have more faith in me than I have in myself. Listen, well, first of all, again, Mark Tyler, Pastor Mother Bethel AME Church, but I come today on behalf of Power Interfaith. Philadelphia is organized to witness, empower, and rebuild, and most importantly, our economic dignity team in support of this bill. I have a prepared statement that I would ask that make sure that all the committee receive. Sure. But I think after hearing everything today, I just want to share my own personal story. When my mother, black woman in Oakland, California, found out that she was pregnant with me back in 1965, early 1966, she was an essential worker. She worked in the cafeteria at one of Oakland, California's largest hospitals, but she was not unionized and her job wasn't protected. She discovered from her own physician that her pregnancy was high risk, and they recommended that she take work off. But she was told by the person who runs the cafeteria, and the hospital backed them up, that if she were to take off work to take...
Pastor? Uh-oh, we may have lost Pastor Tyler. Yeah. Okay, I'm sorry, we lost you for a minute. Pastor Tyler? Pastor Tyler? We may have had a connection issue. Let's try, if we could ask council support to try to reconnect with the pastor, if that's possible. And why don't we, since he's frozen here, we'll go to the next person on the list to testify, Norman Henderson.
Yes, hello. Can you hear me?
Oh, Pastor Tyler.
No, this is Norman Henderson.
Okay, all right. Go ahead, Mr. Henderson. I do apologize. If you want to go to the
Okay, I just want to say, I want to thank the panel for having me and thank everyone for being on call. It is very important.
Yes.
My name is Norman Henderson. I am an agency home care worker, and I am in support of Councilman Brooks' leave bill. Excuse me, I messed up my glasses, and I'm kind of messing up right now.
Okay.
I am in support of the Act of 200303. I just wanted to say, as being a home care worker, it's scary and hard at the same time.
I'm sure.
Can you imagine every time you come in the house, you have to spray yourself down with Lysol, hoping and praying that you're not bringing a disease into your home where you feel safe at and living. I've been working and being a home health care agent for 6 years now. I started out with my grandma, may she rest in peace, and just to take care of someone is very good, you know. And for me to worry about whether or not if I get sick and if I can take off, that's really is there really is no words that I can say that I can not get at everybody, because that's crazy to try to take away people who need to be out there in the workforce. You want to take away their sick days. If I get sick today or tomorrow, I'm hurt. And just to throw it out there, people can get paid $257 for the week. You take off 1 or 2 days from getting that type of pay, like my man said a couple of speakers ago, you're going to be, heart-shaped, missing a meal, having to try to pass your bills off. And they ain't letting us pass no bills off. So I just want to say we really have to look into what we're trying to do to the people. Mm-hmm. As one, we're out here and it's COVID-19, which is scary enough. Now you want me to be even more scary that my employer or the state wants to take away my sick days if I get sick. We need to really get it together. I know we are trying to get it together. COVID-19 has everyone up in the uproar amidst of the other, I'm going to call it pandemic crisis too, with what's going on with the law enforcement. And just to say it's not right. Thank you. God bless everyone.
Thank you, and bless you as well. Thank you so much for your testimony, and we appreciate your words and also staying within the time. Thank you very much. If we could have the absolutely. If we could have the next panelist state your name for the record and begin your testimony.
I'm back. I'm actually back, Council Member Bass.
Yes,
Yeah.
Pastor Tyler.
Yeah,
do you want to pick up where you left off at? We heard your concern over when your mother understood that she was not going to be able to take off.
All right, great.
To address her pregnancy needs.
Thank you. Yeah, I want to make sure before I get bumped off again. So sorry, other panelists, if I'm jumping in there. So the ultimate decision that she faced was keep her unborn child or lose her job, and no employee should ever have to face that decision. Mm-hmm. Fortunately for me, she took the responsibility to be a mother first and was hired later by the post office, where she was able to move herself into the middle class due to a unionized job and the protections that it offered. So personally, and as with Power, Live Free, and our Economic Dignity team, we stand in full support of this bill. And let me just close by saying that we sit at the precipice of a new normal. Many people are sheltering at home. Many are working on the front lines, and all are suffering. We actually have the opportunity now to create a better new normal. So please, ladies and gentlemen of City Council, pass this legislation out of committee and provide 14 paid sick days for our city's essential workers. Let's take regard for our Black bodies and truly make Black lives matter. Thank you so much.
Thank you for your testimony. And if we could now hear from the next person who was on the panel, if you could state your name for the record and begin your testimony.
Hi, my name is Mitch Brewster. Can you hear me?
Yes, we can hear you well. Thank you.
Perfect. Hi, my name is Mitch Brewster. I'm a grocery store worker at a major chain in Philly, and I'd like to testify in favor of the public health emergency leave bill. As someone who's been working on the front lines with the public throughout this pandemic, I don't believe that right now there are enough protections in place for most essential workers to be able to do their jobs in a way that prioritizes health and public safety. At my job right now, when you come into work every day, you are asked if you are presenting any COVID-19 symptoms, currently awaiting test results for COVID-19, or if anyone you live with is awaiting COVID-19 test results. If you answer yes to any of those questions, you are sent home without pay. And while this policy is ostensibly meant to make our workplace safer, because of the economic realities of our work, what it actually does is make a worker ask whether or not it's worth being honest about our current health situation. It means you're not going to be paid for that day. The only way to get paid sick leave is to test positive for COVID-19 or to utilize general paid time off that you've accrued throughout the year, paid time off that is also supposed to act as vacation time, and time off for any other personal emergencies that might arise. For most of my coworkers, especially people who have families and children to take care of, this is time off that is already an incredibly limited resource. This bill would change that and would offer people in our position paid sick leave so that we can act in the best interests of our own health and the health and safety of the hundreds and thousands of people that we interact with at our jobs every single day. It would let us take the time off that we need to take care of ourselves and our family members, and it would stop us from having to weigh the health risks of coming to work against the economic cost of missing out on the day's wage. I'd like to urge all of the members of the committee to vote in favor of this bill. I think that requiring 14 days of paid sick leave during a public health emergency, like the one that we're in right now, isn't radical. It's simply good public health policy. Throughout the last few months, we've seen city banners, storefronts, radio ads, and commercials that have all been thanking people like me and other essential workers for being on the front lines of this pandemic.
Did you drop off? Okay. Well, I checked, and it does have it's still going.
Please put
but the sunset clause really took care of our biggest issues.
Somebody, please mute your phone, Melissa. Okay. All right. Thank you. Sorry.
Sorry. I would just say this bill would be a tangible demonstration of that kind of gratitude by giving us the protections we need to keep ourselves, our coworkers, and the public safe and healthy as we navigate the next few months together. Thank you.
Thank you. Thank you so much for your testimony. And if we could now have the next person on that panel who's queued up and ready to go, if you could state your name for the record and begin your testimony.
Good afternoon. My name is Sam Jones,
and I'm the director of the Restaurant Opportunity Centers of Pennsylvania. Thank you, Committee Chairperson Bass, for having us here. And I'd also like to thank Councilmember Brooks and the co-sponsors, Councilmembers Gim and Heenan, for bringing this bill to the floor. I urge passage of Bill number 200303. We can no longer tolerate a system of corporate bailouts while working people are left out. Councilmember Brooks so eloquently articulated the need for protections for low-wage workers, and I want to thank her for that. You will hear from restaurant owners who have been prompted by the Pennsylvania Restaurant and Lodging Association to oppose anything that protects workers, anything that opposes workers, and anything that benefits the top 1% and millionaires and billionaires. I believe personally that it is more cost effective to provide paid sick days for a sick worker rather than having that worker continue to work sick in order to protect their income, in which case they may infect co-workers and diners, which would result in closure of that establishment. So it doesn't even make economic sense to oppose the bill. I know we have many speakers who have firsthand knowledge and many workers who are eloquently explaining this, so I will yield the rest of my time. Thank you very much.
Thank you very much for your testimony and for joining us today. If we could have the next person on the panel state your name for the record and begin your testimony.
Councilwoman, I don't know if I'm next. This is William Carter. Can you hear me?
Yep, we can hear you well.
All right. I promise to be brief.
No matter how long it takes?
No matter how long it takes. But I've been told...
We got 2 minutes.
All right. Good afternoon, Councilwoman Bass and members of the Committee on Health and Human Services. I'm William Carter, Vice President of Local Government Affairs for the Chamber of Commerce. Thank you for this opportunity to provide testimony regarding Bill 200303, which calls for Philadelphia businesses to pay increased sick leave to employees under emergency circumstances. Although we understand the intent behind this legislation, and probably I more than a lot, I actually co-wrote the legislation that requires paid sick days that is currently realized by city workers when I was in city council. We strongly believe any measure in this regard should adequately consider the economic circumstances of both workers and employers, and not detract from the efforts of businesses fighting to survive at this critical time. COVID-19 remains a historic disruption to the world as we once knew it. The coronavirus has infected hundreds of thousands of individuals, with many succumbing to its deadly effects. We are thankful for the tremendous efforts of our healthcare, government, and essential workers who have been battling on the front lines of this pandemic. Likewise, we greatly appreciate the efforts of numerous public-private partnerships as well as the philanthropic community in helping to keep our city's economy from fully collapsing. All of these efforts are measurable and invaluable and have given our city a chance to recover. Given all that has been done, however, there is still much more to do. Philadelphians want to go back to work, and in order for that to happen, we must first ensure there's actually work to return to. This requires a full recognition that businesses, both big and small, have experienced extraordinary financial hardship. Our local business owners have suffered significantly reduced revenues, with many losing more than half of their regular income. Several have been forced to take on additional debt to stay afloat, and sadly, many have had no choice but to shut down permanently. Bill 200303, as introduced, falsely assumes that owners not only have the revenue to cover current overhead and pay returning employees, but also the reserves to pay the cost the bill would impose. Additionally, sick leave was not meant to be a benefit paid in lump sums to all employees at a specific time. I know this because I helped co-write it. Businesses generally plan for a few workers to be out over manageable periods of time, allowing for other staff to continue running the business in the absence of workers that are out. Under this legislation, should a COVID-19 emergency be declared, businesses, while shut down, will have to pay a lump sum of sick leave to all of its employees immediately. Mandating such payments while local companies are still hoping to recover from the devastating effects of this pandemic, as well as recent destructive demonstrations, could very well be their death knell. At this critical time, measures that seek to protect the entirety of our economy are paramount. Remarkably, a bipartisan Congress found a way to advance legislation that considers both employees' livelihoods and employers' bottom lines. In addition to
Mr. Carter, Mr. Carter. I'm sorry, you're at 2.5 minutes.
That's how long it took. That's how long it took. I will say, in closing, Philadelphia workers and businesses have collaboratively answered the call to maintain our city during the COVID-19 pandemic. This legislation unnecessarily divides our citizenry at a time when continued shared recovery is needed. As no one knows what the new normal will be, we have to be mindful that in order for workers to work, employers must be in a position to employ. Any level of one-sided legislative overreaction could result in dire consequences. On behalf of Philadelphia's business community, we appreciate City Council's understanding of this reality as they consider the mandates this legislation proposes. Thank you.
Thank you for your testimony. And is there anyone else left on this particular panel to testify? And are there any questions from members of council for this panel? Okay, Councilwoman Brooks.
Yes, thank you so much, Madam Chair. Mr. Carter, I want to begin by thank you for your work on paid sick leave. But I also would like to talk about how traditional paid sick leave works in Philadelphia. So workers have to accrue a maximum of 40 hours of benefit over a year. Am I correct?
I think she's...
I'm sorry, Councilman, are you talking to William Carter?
Yes, to William Carter. How are you?
Oh, hey, how you doing? I didn't know.
My apologies. I have a question about how time is accrued. So
yes,
workers have to accrue a maximum of 4 hours benefits over a year. Am I correct?
You can start earning it's not necessarily over here, but you can start earning it. It's it is called earned sick leave. It's what you earn. It's not automatically given to you. You have to work a number of a period of time. Yes.
Okay. So in March, when we went on shutdown, how many hours would a typical worker have accrued when we were on shutdown?
I can't answer that question. Honestly, I have a lot more questions about the legislation as written that have not been necessarily cleared up. We have had a couple of calls with you, but we have questions regarding whether or not, if there is a pandemic declared or a declaration, is 2 weeks worth of paid sick time automatically due in a lump sum to if you have 10 or more or 20 or more employees?
I don't think it was due. It's not an immediate paid out.
When the pandemic first began, there were articles in the paper about restaurants that had to pay at least 12 people a week's worth of pay immediately and without still being in business. And so that was concerning because I know when we wrote the legislation, it was intended that somebody might be out this week, somebody might be out in 2 weeks, somebody might be out a month from now, but you didn't expect that all 12 of your employees would demand paid sick leave right as soon as the governor or the mayor says, hey, you got to shut down. And a lot of small businesses, a lot of business period, just weren't prepared to have those reserves in place to do a immediate benefit payout to everybody, which is obviously a lump sum. And so we were just concerned about that. I mean, obviously, and nobody wants anybody to have to risk being sick or going to work. We understand the intent behind the legislation. It's really about how it's paid for. And so
to answer that question,
I just highlighted in my testimony how Congress was able to allow tax credits to businesses to offer this, and it just considered both businesses and employees, and we really appreciated that.
Yeah, so what I would say is part of this legislation was forward thinking. So the focus of the bill was to make sure that this legislation is looking towards moving forward. So we removed the retroactive provision of this bill like we talked about on the call. And I also believe that if workers have access to paid leave, it will prevent all employees from getting sick at the same time. That's why we are introducing this legislation. But we definitely made it retroactive. That is a provision of this bill.
And I agree with you, Councilwoman, and I appreciate that. I think that the only issue is, should in November there be another spike and the governor or mayor say, we are shutting down all businesses right now, does each business then have to pay 14 days of paid sick leave right then because their employees aren't working? And do they have to have reserves to do that, or is there any subsidy from the government to help in terms of paying that. That's the main issue.
So our bill would not require that.
Same time.
Our bill would not require that, and only if their employees, everybody was sick at the same time. That's what you're asking, if everyone got sick on the same day?
Well, the bill, as it was introduced, at least, it says that once an official declares that there's an emergency, just like what happened in March, and everybody has to go home and businesses have to shut down, then that sick leave is due, whether you're a gig worker, whether you're a regular worker, whatever. And so imagine if you're a gig worker and you've only been on the job for this particular company for a day or two, and the governor declares an emergency. Now the business has to pay this one gig worker 14 days of sick leave who's only been on the job for 2 days. So because it doesn't matter whether you're sick or not, it's if you have to be home because it's declared by the government that you have to be home, then businesses are required to pay this.
So thank you for clarifying that. But that was addressed in the amendments that we introduced. One of the third, fifth round of amendments, we did definitely introduce or clarify that. But right now, requirements are the same as the federal law. So access to leave is the same as the federal law currently.
Well, right. And I think under the federal law case, and you can correct me if I'm wrong, if there's a declaration of an emergency, then the federal government helps you pay that lump sum that you have to pay. This legislation doesn't. There's no help. You just have to pay it right out front. Unless you guys can clarify that further for me.
That's not exactly correct, but let me get the thought. So this bill expands the federal law in a few ways. One is that it applies to gig workers and healthcare workers. Am I correct? Hold on one second. Domestic workers, guild workers, and healthcare workers. I'm not really sure which group are you currently talking about, but it also makes sure that if a person works more than 80 hours per pay, they would receive comparable leave.
Yeah, no, I totally understand that, Councilwoman. And like I said, I think we all can agree that we want to make sure that everybody's taken care of during this time. And I think that our only ask is that you consider the legislation consider the businesses that are struggling as well as the individuals that are struggling, because it wasn't just a health a pandemic or a health emergency, it was also an economic emergency.
Absolutely.
And, we have individuals who just are holding on during this time from the pandemic, and then we have businesses whose storefronts were looted and crashed in and everything, and they're trying to recover from that. So that's two different disasters, and we just want to make sure that this legislation doesn't end up being a politically sponsored disaster, and that these businesses aren't forced to pay costs that they can't incur at this time. Because once again, you have to have a job to go back to. That means a business has to be viable in order to rehire people, and we want to get our economy back up and running better than it was before.
And I completely agree, Mr. Carter. So I thank you so much for those considerations. We have addressed many of them in our current amendments, and this is an ongoing conversation on anything else that we need to change. But I think we may have addressed everything that you spoke of already. But if you have any other further questions, I would love to continue this conversation offline with you.
That's much appreciated. Thank you, Councilwoman.
Mm-hmm.
This is Terry Fromson. May I quickly respond to this question on the table?
If you could hold your thoughts for 1 second, because we have a lot of folks that we're trying to get through. But if the councilwoman wanted to address, Councilwoman Brooks, did you want to address Ms. Terry Fromson?
Sure.
CLS, yes.
So I'll just be brief. I think these issues were all addressed at the beginning of the hearing. The small businesses are subject to federal law, and they are the ones who are getting the tax credit, and they are not affected by this bill. Secondly, there are very specific triggers for when someone gets sick pay. It's not all due at one time as when an emergency is called. It's you're probably confusing what was originally in the bill, which was closing businesses. That reason has been removed. So I think your concern has been fully satisfied.
Councilwoman Bass, may I ask a further question?
Certainly.
All right, and
well, we need to wrap this up. I do apologize, everybody. I know this is, this is one of the things that I think we'll have an opportunity to discuss at length, after the hearing, because there's still a lot of questions. I know the amendments just recently came out, and everybody hasn't had a chance to thoroughly review them. So I know that there is going to be.
Yeah, well, Councilwoman, I'll just say, Councilwoman, I'll just say that yes. We haven't had a chance to see the latest amendments. The last amendments we got were given to us late Friday. If there are some new amendments, it's my understanding there are new amendments that have been offered right now as we currently speak, and so I haven't had a chance to see those. So my testimony is based off what I have read, and so if we can handle it at a different time, understanding the time constraints we have now, and I'll look forward to discussing it with the sponsor and anybody else after this hearing.
Very good. Very good. Thank you, Mr. Carter. Thank you, Ms. Fromson and Councilwoman Brooks. And if we could have the clerk call the next panel forward.
Madam Chair.
Yes, Councilman.
Yeah, just very, very brief. I just want to make sure I understand. I just want to make sure I understand the tenor of Mr. Carter's question. Under federal law, it only applies to the federal law only covers businesses with less than 500 employees. The amendments to this legislation covers businesses with 500 employees or more. So small businesses would not be covered under this legislation. But I think what I heard from you is that under the federal law, tax credits are provided, and you're suggesting that this law should provide tax credits for those who may be impacted by the law, which are businesses 500 or more. Is that my understanding?
Councilman? Hello?
Yes.
Councilman, I didn't hear the last part of what you said.
So Did you want me to just restate it?
Yes, please.
All right, so the federal law covers businesses with less than 500 employees. Under the amendments to this legislation, those businesses are not part of this legislation. So basically, small businesses, businesses with less than 500 employees are not applicable to this legislation based on the proposed amendments. However, businesses with 500 employees or more would be impacted by this legislation. And what I thought I heard you say that because the federal law provides tax credits, your suggestion is that this law should also provide tax credits for those who would be applicable to this law, which are businesses with 500 employees or larger.
I'm not necessarily saying it has to be tax credits. I think that we need to consider legislation that considers both the business side of our society and the employee side of our society. And I would say that the federal legislation did remarkably, bipartisanly, did a pretty good job of that. It allowed for workers to stay with some income, and it also assisted businesses in helping to do that. This legislation, as originally written, didn't have any consideration in it for our hardworking business people out here. And that was a concern of mine. And then the amendment that we received on Friday did exempt businesses of 500 or less, and we got that late Friday. However, I would still say that any business that's left over that it still applies to, I still haven't seen that they're not required to pay lump sum of paid sick leave upon Jim Kenney or Governor Wolf mandating that everybody shut down. And so I would definitely like to see that, because I don't think that anybody should have to pay lump sum that much. Yes, if people are sick, yes, we want to make sure that people are taken care of while they're sick. But if you're forced to go home because you're not sick, or if the governor or any authority says, hey, we're shutting down the economy, then businesses who aren't still realizing income are then still forced to pay a lump sum to however many people work at their restaurant or work at their business. It could be upwards of 30, it could be 40 people, or it could be over 500 people. which is still, imagine if you had to pay a lump sum to over 500 employees. That's something I hadn't even considered. You have to pay a lump sum to over 500 employees at one time because the governor or the mayor says we're shutting down the economy. That's a significant burden on a business, period, no matter what size you are trying to recover.
Thank you. Madam Chair, if I could just make one point of information.
Hello?
Yes, Madam Chair?
Yes, I'm sorry. I lost connection on my own.
Okay, yeah, I didn't see you. I was like, wait, where is she? Just one point of information. I know traditionally when we have council hearings in person, we often have the amendments that have been offered as well as testimony where people are able to access them by coming up to the desk in council chambers. Because we're doing this in a virtual session, there's been various amendments that have been floated. I think Ms. Aponte just sent earlier prior to this council session the last version of amendments and the witnesses, as well as a quick fact sheet. I know in some of the other virtual council hearings that we've had, legislative staff have provided those amendments have shared that in the chat function. So to the extent that's able to be done, like we've had in other virtual council sessions, that could provide the public the opportunity to see the last draft amendments, as well as the talking points regarding those amendments, so those can see them like we would traditionally do in a council session where a person could actually grab the physical copy of the amendments. Thank you, Madam Chair.
So we will ask the clerk if she can work with the technical staff to be able to make that information available. And if not, then folks can feel free to contact my office or Councilwoman Brooks's office for copies of the amendments, and we'll certainly make those available.
Madam Chair, my staff is working on making sure it's shareable now.
Very good. Very good. Thank you. If we could have the clerk call the next panel forward.
Hi, we still have one more person for this panel that we over. Sorry, Elise.
Thank you. Good afternoon to all the members of City Council. My name is Elise Ford. I'm the Vice President of District 1199C. I'm testifying on behalf of Bill number 200303. 1199C is an affiliate of the National Union of Hospital and Healthcare Employees, representing more than 13,000 members working in major healthcare institutions throughout the Philadelphia region. I come before you today to talk about a very important issue, the health, safety, and the well-being of healthcare employees during a global pandemic. Our over 13,000 members support Councilwoman Brooks' bill, which will provide paid sick leave for healthcare employees who are unable to work if they contract a contagious disease during a pandemic or epidemic event. Thousands of healthcare employees are working daily on the front lines in the face of COVID-19. Many of these workers are high-risk situations, caring for elderly patients and those in need of long-term home care. The State Department of Health mandated that nursing home workers become tested, and if they test positive, then they are not asymptomatic, then they are required to quarantine for 10 days or sometimes even longer to avoid the spread of the disease. For some of our members, that might have been all of their time. A lot of our members only have a certain amount of sick days that they are able to obtain. So some workers are placed in a position where they are going without any pay during the time that they are quarantined. We just would ask, on behalf of 1199C, we ask that you continue to support this bill, and that Councilwoman Brooks, you do have our support, and we ask that you continue to fight for our healthcare workers and allow them to be able to have the sick leave that they need, because these are the people that are on the front lines caring for our elderly every single day. They put their lives on the lines, and we have to stand with them and make sure that they're taken care of.
Thank you very much for your testimony. And is there anyone else who has any testimony from this panel? I believe you said that was the last speaker, Madam Clerk. Okay.
Yes.
And so unless there are any questions from members of council, and seeing none, if we could have the clerk call the next panel forward, that'd be great.
The next panel includes Melissa Bova, Jill Weber, Rocco Sema, Jeff Michaud, Stephen Starr, and Mark Edelson.
Okay. And if we can have those who are on that panel, if your name was called, please prepare yourself to testify. And if we could have the first person, I believe it was Melissa Bova, if you could state your name for the record to begin your testimony. And again, because we're hearing so much testimony today, we were asking folks to limit it to 2 minutes. So if you could maybe just summarize your testimony and give us a sense of your thoughts on the bill, and just a summary will be sufficient at this point, I think.
Thank you, Councilwoman Bass, and members of the committee. I have good news. Many of the people, if not all the people on my panel with me, no longer need to testify because of all of the work Councilwoman Brooks and her team have done with us. So I'll provide a brief overview of our position, and then hopefully I will save you all a bit of time before the end of the day.
Okay.
So I believe over the past 3 to 4 days, you all have been hearing from many of our restaurants and hospitality businesses in the city about their concern about how this legislation would impact them. As originally introduced, it would have had a devastating impact on small businesses within the city of Philadelphia. They were scared, they weren't sure what to do, and the reaction, as many of you felt over the course of the weekend, was shock, fear, and every emotion in between. This was not about not wanting to care for their employees. That is the first thing they want to do, is about not being able to under the requirements of the legislation. Over the past few days, Councilwoman Brooks and her entire team have worked with us literally over the weekend to address many of our concerns as it pertains in this legislation. I think in the beginning, we were kind of two ships passing in the night until we realized we all were on the same team here, and the goal was to cover those employees not covered by Families First. And they worked with us to ensure that those small businesses, the 500 or less that are protected by Families First, continue to have that opportunity, acknowledging their inability to potentially provide this leave, mimicking Family First, and also putting in that sunset provision, which recognizes when that Family First leave ends. So to that end, many of our concerns have been addressed. I would say the only concern that's probably still out there is from some of your small franchisees that might not be covered by Family First. But I do want to thank Councilwoman Brooks again and your staff for giving us the weekend to work through our concerns, ensuring that we aren't impacting those that are covered by the federal law and not putting on additional burdens. And with that, if there are any questions, I'm happy to answer them. But I do believe that many of our testifiers, with the amendments that have been offered today, their concerns have been alleviated. Thank you.
Very good. Okay, well, very good. Glad to hear that. If we could have the next panelist state your name for the record and begin your testimony.
Everybody might have dropped off. Oh, Jill.
Yeah, this is Jill Weber. I was going to just drop off, but I did want to say that, yes, indeed, most of our concerns, my concerns, were alleviated, particularly with the questions from William Carter, because some of my concerns, I do feel very strongly about my staff, and I do feel very strongly about trying to take care of them, but it is very difficult in a pandemic when we are closed, and when the notion of a lump sum payment, as Mr. Carter was asking about, comes up. That is the main concern. I think that is something that you all have been told about by him, and it's something you're all thinking about anyway. So that is absolutely my main concern. So thank you very much.
Thank you very much, Ms. Weber. Is there anyone else left on that panel to testify or to speak on this matter? And seeing none, if we could have the clerk call forward the next panel. Oh, I'm sorry.
Rocco Sema.
Rocco
Sema.
Okay. Please state your name for the record, and please, if you wouldn't mind summarizing your testimony.
Yes, good afternoon. My name is Rocco Sema. So I own multiple restaurants in Philadelphia. I've built a company in Philadelphia for the past 12 years, and I've employed over about 100 people. I'm currently looking for more locations and concepts in the Philadelphia area. However, if this bill passed with the current language, I will not be continuing to expand in Philadelphia. I want to give some facts on the restaurant industry for people that do not have experience, like many that are involved in this bill.
I'm sorry, Mr. Seamus, have you, I'm just wondering if you had a chance to see the amendment yet, or if you spoke. Ms.
I do.
Bova, and you still have concerns. Okay, I
Correct.
just wanted to be,
Correct. I just want to
wanted to
get
be clear. Okay, sure. Go ahead.
the restaurant business is unlike any business, and I think it needs to be addressed separately. For instance, profit margins in restaurants are 5 to 10 cents on a dollar. Payroll taxes tend to be higher because the industry is a high turnover industry, and 85% of restaurants do not last more than 2 years. Due to the COVID, we've been forced to use these third-party platforms as far as the Uber and Grubhub, which take upwards of 30-35% of our tickets. With this, our projections to get to pre-COVID numbers, we're looking at about a year or two more. I just think the bill timing is a little kind of kicking us when we're down, and I believe this bill will actually eliminate jobs. For instance, on my aspect, this will create us to develop more automation. This will increase us to reduce staff, reduce wages. Every team member on my team gets paid over minimum wage. We have, flexible schedules. We offer the support, but I think this bill is going to give the opposite. Just cost alone on this bill, I'm looking at a 6-digit cost. I'm a small business owner with a few locations, so that's where my concern is, and I think that the bill is overreaching the COVID and the pandemic on that. I think the bill can still be passed, but I think it needs more restaurateurs involved in it and educate the concept of what our operations cost. One of the examples I think is to give the tax credits or some kind of city tax credits to help oversight these costs that we're incurring. With the more online contactless ordering, we're paying more just to operate. And I think it should be something that we develop with our own teams in our own restaurants and establishments without the government interference involved in that. We definitely want the well-being of our staff to take priority, and we work with them on a daily basis. But getting the government involved with this without understanding how a restaurant operation works, I think is a little bit of an overreach.
Okay. Well, thank you very much for your testimony. Appreciate your feedback. And I think that, the more discussion, the better.
Absolutely.
So, thank you so much for your testimony. Is there anyone else to testify on this panel? And seeing none, if we could have the clerk call for the next panel.
Madam Chair.
Yes, Councilman Green.
Yes, just very quickly, I want to thank the last person for his testimony. I'm glad that as the legislation has been amended, his group of businesses would not be affected by this legislation because his business has, I believe he said, about 100 employees, and this legislation will only affect businesses that had 500 employees or more. In addition, the issues you raised regarding some of these third-party entities like Grubhub and DoorDash, there was other legislation that we addressed in the Law and Government Committee hearing, where I serve as vice chair, because there was a concern that restaurants, maybe like yourself, were getting negative responses from their customers, thinking that they were actually charging higher fees when that actually was not the case. So it was legislation that was introduced in this body in the Law and Government Committee, which we look forward to passing, which will address that issue so that you're not being negatively impacted by these third-party entities charging higher fees for you to provide goods and services to your customers. So thank you, Madam Chair.
Can I respond to that?
Certainly.
Yes, I mean that.
Quickly, please.
Yes, absolutely. My 2019 numbers, I paid these third-party fees $400,000 plus. So I'm aware of the bill. We've been reached out to by all these companies to try to support them, but I'm definitely aware of that bill, and I like that bill. My question is what happens for employees after January 1st? Because does the Federal CARES Act, are they excluded from that, and does that put me back into play?
Well, Madam Chair, if I could respond, this legislation based on the amendments sunsets December 31st of 2020.
Yeah. So that's the end of it. In December 31st, 2020, the coverage that will be protected or will be offered under this bill would end December 31st.
So anyone hired after January 1st, we would now be liable for this bill.
Anyone hired?
No.
Go ahead. I'm sorry, Councilman. Councilman, you're on mute. You're mute. Hello.
Okay, there we go. Playing
Okay.
Microsoft Teams unmute mute tag. But just like the federal Family First legislation, this legislation expires on December 31st, 2020.
Thank you.
Okay. If we could now have the next panel called forward.
Madam Chair, there are no further witnesses.
Okay. Is there anyone else present that would like to testify? Seeing none. That concludes this hearing. That concludes the public testimony. I want to thank all of the panels and witnesses for their participation today. We value your opinions. And I now invite all panels and witnesses to please disconnect from the meeting before we go into our public meeting. And we are going to now pause the proceedings briefly as multiple participants leave the hearing. Again, if you were on one of the panels and witnesses, please disconnect from the meeting so that we can go into our public meeting. We are pausing to give you time to disconnect from this hearing. Thank you so much. I see that folks are disconnecting. Okay. This concludes the public hearing of the committee. We will now go into a public meeting to consider the action to be taken on the bills before the bill to be taken before this committee today. And if we could ask for, or actually before we proceed, we're going to take just a brief pause. One moment. Now going to resume. We are now going to resume our public meeting. One moment. Okay, we're going to ask the clerk to please call attendance and take the roll. Members that are in attendance will please indicate that you are present when your name is called. Also say a few words just so that your name appears on the screen. And if we could have the clerk call the roll.
Councilmember Heenan.
Councilman Heenan is present, and I want to thank all the members for having this deep dive conversation about workers and the blend with reopening up our business. Thank you.
Thank you, Councilman.
Councilmember O.
I am present, and thank everybody for their patience throughout this hearing, and thank you, Chairman.
Councilmember Ginn.
Anytime.
Thank you very much, Madam Chair. I am present.
Thank you.
Councilmember Green.
I am present.
Councilmember Thomas.
Present.
And Councilmember Brooks.
Present.
Okay. Thank you, Madam Clerk. A quorum of committee members is present. The chair now recognizes Councilman Heenan for a motion on the amendment of Bill number 200303.
Madam Chair, this is Councilmember Gim. I put in the chat if I could just make a brief comment.
Can you hold your comment just for a moment? Am I holding for, or did you need to make it now, or? I'm sorry, I missed your statement. I missed your request in the chat.
No, I just
if you could hold for just a moment, let's just go through and then we have to recognize, if you don't mind.
That's fine.
Okay. All right. The chair recognizes Councilmember Heenan for a motion on the amendment to Bill number 200303.
Thank you, Madam Chair. I'd like to make a motion on the amendment to Bill number 200330. And amendment has been circulated to all members of council, and I make a motion to approve on the amendment.
Second.
The chair notes for the record that council member, I think it was Gim, seconded the motion. It has been moved and properly seconded that Bill number 200303 be approved. All those in favor of the amendment signify by saying aye.
Aye.
Aye. Anyone opposed? No? Okay, the ayes have it. The motion carries, and the amendments to Bill number 2003. The chair now recognizes Councilmember Heenan for a motion on Bill number 200303 as amended.
Thank you, Madam Chair. I'd like to make a motion with Bill number 200303 as amended be reported out of this committee with a favorable recommendation as the rules be suspended for our next session of council.
Second.
Okay, the chair recognizes for the record that Councilwoman Gim seconds the motion. It's been moved and properly seconded that Bill number 200303 is amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
Aye.
Aye. Anyone opposed? Okay. The ayes have it, and the motion carries. And Bill number 200303 as amended will be reported from this committee with a favorable recommendation. This concludes the business before the Committee on Public Health and Human Services today. And I want to thank you all very much for your attendance. And I'm sorry, but back up 1 second. Councilwoman Gim wanted to make comments.
Yes, I just wanted to say thank you, Madam Chair, for your leadership on this bill, and I really want to thank the bill's sponsor, Councilmember Brooks, on a major effort. I know this was a complicated effort, but it's an important area, especially right now. The bill now reaches people who had long been left out of the city's traditional paid sick leave package. It recognizes the importance of, the protections that are necessary at the municipal level when the federal government is doing its own thing. It leaves out so many people as well. And so I just want to thank the bill's sponsor and all members of the committee for taking a bold step forward during this time. Thank you, Madam Chair.
Thank you. Thank you for your comments. And with that being said, the meeting is adjourned. Thank you so much, everyone, for your attendance and patience today. Have a wonderful afternoon.
Thank you, everyone. Have a great afternoon.
Thank you.
Thank you very much.